started looking at diseases of the ruminant respiratory system, and we started in the upper respiratory tract, and basically we're going, from the nasal cavity on backwards and down the respiratory system. So it's just one way that you can organize your study, just to start at one end and work your way to the other end. And we're only looking at a handful of conditions that affect the ruminant respiratory system, trying as much as possible to make them non-infectious diseases. So where we had left off the other day was in the pharynx, and so now we're down into the larynx. All right. So, pertaining to the laryngeal region, and again, what you should do as you read through your notes is look at the similarities of these different conditions and think to yourself how you would diagnose what's going on with the animal. So one of the things you're going to be looking at is the clinical signs that they're showing, and when you auscultate the animal with your stethoscope, where you are hearing abnormal sounds. So you'll notice the clinical signs for the laryngeal diseases are pretty similar as far as the signs of dyspnea and difficulty breathing, extended neck, salivation, mouth breathing, etc. So pretty similar set of signs. That's just because of the nature of where the abnormality is located. It's a small area, the laryngeal region. So the clinical signs are going to be fairly similar. And basically, the way you're going to rule out which one of these conditions you're dealing with is by your diagnostic test. So you notice endoscopy tends to be repeated for each of these conditions. So endoscopy would be one of your good diagnostic tests to perform, assuming, of course, that you can afford it, or radiographs would help you to localize the source of the abnormality. But as far as what causes laryngeal obstruction, you see there we have listed abscesses, granulomas, papillomas, and then as we go down the list, you see abscesses, granulomas, and papillomas described in a little more detail. The other thing you're going to notice as you read through these different conditions is which ones tend to occur in feedlot cattle. So that's going to be another one of your clues as to what condition might be going on. So I helpfully wrote feedlot cattle on the side here, and hopefully you'll make note as well as far as which conditions tend to occur in feedlot cattle. And when you read that description in an exam or in real life, you're faced with an animal that's been in a feedlot, then hopefully that will trigger to your mind what may be going on with that animal. A couple other things to make note of, and I'll when we end the lecture, we'll end with talking about anaphylaxis. Respiratory system, main target organ for anaphylaxis and ruminants. So every year I ask one or two questions pertaining to that, and I create a scenario where the animal is in some degree of anaphylactic shock. It's a transfusion, it's respiratory failure, and I ask for the first sign that you would see. So in ruminants, the first sign that you see when they're going into anaphylactic shock is going to be respiratory. So they have great difficulty breathing. About half of the class tends to write urticaria or hives. Later on, they do develop urticaria or hives, but if you're depending on that as your first sign that you're going to see to tell you that the animal is in anaphylaxis, you're going to miss it. In ruminants, the first sign of anaphylaxis that you see is going to be respiratory. So you're going to see respiratory distress. All right. Let's see. Some other things to point out with these conditions Laryngeal abscesses, for example, abscessation of the arytenoid cartilages. So that's the causative agent, actinomyces pyogenes. Laryngeal granuloma may originate from chronic laryngeal contact ulcers, and laryngeal papillomatosis caused by papillomavirus, papillomavirus. So that's a little tricky because when you have a multiple choice question and it's actually a papillomavirus, you might want to choose that, but it's actually a papillomavirus, slightly different structure. All right. So let's see. So that's pretty much what I want you to concentrate on when you read your notes, as far as the similarities and the diagnostic tests that you perform to rule out one of these conditions. The treatment is going to be pretty similar as well. You're dealing with something that's causing an obstruction or some degree of difficulty in breathing. So you're going to have to make breathing easier, or give the animal something that's going to allow it to breathe easier. So anti-inflammatory drugs, a tracheostomy in severe cases, and antibiotics if there's a bacteria to treat. All right. So now we move on into the trachea. So tracheal foreign bodies, stenosis, collapse, and stricture, and tracheoedema syndrome of feedlot cattle. So again, that last one is going to tend to occur mainly in feedlot cattle. So hopefully you're making notes of which conditions tend to occur in feedlot cattle, and when you're presented with a scenario, you'll have in mind a short list of conditions that pertain to feedlot cattle. If you read in the history that it's a feedlot and you're called up to the feedlot to look at these cattle. All right, so the tracheal foreign bodies and stenosis, collapse, stricture, again, you're dealing with conditions that obstruct the breathing, and in the course of your physical exam, you're listening over the trachea as well. That's another thing at this stage of your career, you may just use the stethoscope and listen to the lungs. But when you're evaluating the respiratory system, you need to evaluate the entire respiratory tract, including the trachea. And when you listen over the larynx, pharynx region, and then down over the trachea, you may also hear abnormal sounds that could clue you into what's going on with the animal. The inspiratory dyspnea that we spoke about earlier, remember we spoke about upper respiratory tract diseases tending to be characterized with some degree of inspiratory dyspnea. So here you're seeing that with tracheal foreign body, and you can just intuitively think what's going on with the animal, and it's really having to struggle to breathe in through that partially obstructed trachea. And as well as a stridor over the trachea, so stridor, a sort of a whistling sound, and you pick that up when you listen with your stethoscope over the trachea. Sometimes it might be loud enough to where you could hear it without auscultating the animal. And you're also seeing some other signs of dyspnea, extended nasal mouth breathing, excessive salivation, because the animal is struggling to breathe so hard, so much that it's not swallowing the saliva, so the saliva is just dripping from the mouth. By the way, when I ask you to list signs of dyspnea, don't write dyspnea, but the sign of dyspnea. Okay, so if you've noticed over the last few days, when I talk about dyspnea, I'm talking about difficulty breathing. So what does an animal look like when it's having difficulty breathing? Open mouth breathing, extended neck, etc., etc. All right. Let's see. Tracheal stenosis, collapse, and stricture. One thing that'll tend to give this one away is that it's going to tend to be in a younger animal or in a smaller animal. So it's not that often that the trachea is stenosed or collapsed, but when it does happen, it's typically associated with some degree of trauma, or it may be congenital. So in a minute, I'm going to show you a case that was more than likely congenital. So younger animal or smaller animal is where you tend to find tracheal stenosis, collapse, and stricture. And again, you're getting this prolonged inspiratory phase of respiration, so inspiratory dyspnea. And all the textbooks talk about this honking cough, so that tends to be characteristic as well. You would think that you'd be able to palpate it, so it may be palpable, but the thing is that a lot of times it's in the intrathoracic trachea where the collapse is, so you're not able to palpate that. But certainly if it's in the cervical trachea, then you'll be able to palpate it. Other than that, your diagnosis, again, is going to be based on endoscopy or radiology, taking radiographs. And the thing about tracheal stenosis, collapse, stricture, since it does occur in a younger animal or in a smaller animal, and there's really no cure for it. So basically, you're talking about placing some sort of prosthesis to open up the trachea and trying to buy time, trying to buy a couple of weeks until the animal gains a little more weight, and then you take it to market. The type of prosthesis that we use is nothing fancy. It's just like a section of PVC pipe, and you cut a U-shaped section of the PVC pipe, and then you place it over the trachea, and you suture it to the trachea, just to try to keep it open. And it usually works at least for a couple of weeks. So this case is discussing tracheal collapse in an adult goat, and there are a few things that we're going to emphasize when we look at this case. Let's see. So the clinical signs that the goat was presenting with: coughing, choking, and foaming at the mouth, and becoming cyanotic. So that's telling you that it's really having difficulty breathing to the point where it's becoming cyanotic. Remember we said in an earlier lecture that you don't often appreciate cyanosis in ruminants, but when you do, it means that they're seriously compromised as far as their ability to breathe. And unfortunately, this goat did die before he got to the hospital, and then the rest of the findings were based on necropsy. And they were able to grade it, tracheal collapse grade 2. So the article talks about how you classify tracheal collapse. So they have grade 1, 2, 3, and 4. And you're usually, you're asked, how do you grade tracheal collapse, and or what percent reduction in the lumen of the trachea corresponds to what grade. So grade 1, 2, 3, 4. So 25% reduction, 50, 75, and almost 100. So 25, 50, 75, 100, 1, 2, 3, 4. So that's pretty much how tracheal collapse is graded in all species. All right. So tracheal collapse and airway obstruction should not be confused with tracheal stenosis. So tracheal collapse more correctly deals with the congenital problem. The species in which tracheal collapse has been reported, you should also make note of that. So this was a goat, so this was caprine, so this could be added to this list. So you'll notice calves, so we're discussing respiratory disease in ruminants, so calves, but also foals, as well as dogs and cats and humans. And then this was a case of a goat. So for your large animal species, it would be calves, foals, and goats. Your small animal species would be dogs and cats, and then of course humans. All right. And let's see. So they're further discussing the typical clinical signs that you also have in your notes: coughing, dyspnea, so difficulty breathing, Exercise intolerance, what that means for ruminants is basically they don't want to move around and eat. So as a result, they're not eating, so they're losing weight, so weight loss. And because the animal is trying to compensate for its inability to breathe properly, you also get some degree of tachycardia as well. And if it's a severe enough collapse, you could also have an animal presenting with cyanosis. The diagnosis, tracheal palpation, like I said earlier, if the part of the trachea involved is in the cervical region, then you'll be able to feel it. If it was intrathoracic, then you probably wouldn't be able to feel it. But if you did radiographs or pass an endoscope or even did fluoroscopy, then you'd be able to visualize it. And treatment, as I said earlier, would be an external prosthesis to at least buy time to take the animal to market. All right. And then the last condition we look at in the trachea, tracheal edema of feedlot cattle. So again, a condition that tends to occur in feedlot animals. And cause is unknown, so we're not sure exactly what causes it. The slides that I showed you last week, when I was showing you the feedlot slides, tracheal trauma from feed bones. So that's just a hypothesis that maybe just reaching through the fence and constantly rubbing their necks on the concrete trough or the feed bunks may contribute to development of the disease. So bottom line is the cause is unknown. And one thing to pay attention to is the two forms of the tracheal edema syndrome. So you have an acute dyspnea form and a chronic cough form. So two forms. And as you read through your notes, you might want to make a chart or just make two columns to compare the two forms of tracheal edema syndrome. There are some things that you'll note. Acute dyspnea tends to be in heavier animals in the latter period of being fed in the feedlot. So in the history, you're going to hear that the animal has been in the feedlot for a while, say a few weeks. Whereas the chronic cough form is going to be in lighter cattle, so those are the cattle that have just come onto the feedlot. So if you're getting the disease in animals, or if you're presented with animals that have been in the feedlot for a while, then you're going to be thinking acute dyspnea form. If the presentation is that the animal has just come onto the feedlot, then you are probably dealing with the chronic cough form of the disease. The clinical signs of the acute dyspnea is acute dyspnea. So that's going to be your presenting complaint that the animals have been on the feedlot for a couple of weeks. They appear to be doing fine up to yesterday, and then today they're noticing this open mouth breathing, extended neck, and so on. So acute onset of dyspnea in cattle that have been in the feedlot for a while. Or the chronic cough form is animals that have just come onto the feedlot and then they notice that they develop this cough, right? So you can imagine that, they've just come onto the feedlot and they're coughing, so the first thing that's going to come to mind is probably pneumonia. But in the back of your mind, you should also have the possibility that it could be a tracheal edema syndrome. And then how would you diagnose acute dyspnea versus chronic cough form of tracheal edema syndrome? Basically the history and the clinical signs. So the history, again, I keep emphasizing it, the history would be either an animal that's been in the feedlot for a few weeks, so that would be the acute dyspnea form, or an animal that has just come onto the feedlot, so that would be the chronic cough form of the disease. And the acute onset of dyspnea versus an animal that's developed this deep, non-productive cough, and it's just come onto the feedlot, would the way you make your differential based on the history and clinical signs in both the acute dyspnea form or the chronic cough form. Endoscopy would give you your definitive diagnosis, so the endoscopic findings are mentioned there. Bear in mind that on a feedlot, in a feedlot situation, you probably are not going to be spending a lot of money on treatment or diagnosis for that matter. Your diagnosis is going to tend to be based on the history and the clinical signs. Yeah, I'm doing a lot of that too. I think the pollen count is increased or something. Yeah, my eyes are killing me. Yeah. So anyway, just try to endure. All right, so the endoscopic findings are listed there, but bear in mind that you probably would not go to the extent of performing endoscopy in the vast majority of cases. And as far as your treatment and control, for the acute dyspnea form, again, these are cattle that have been in the feedlot for a while, so you do want to treat them because they're getting ready to go to market. You may consider antibiotics and corticosteroids. Just bear in mind that you have to be aware of the withdrawal time since these cattle are getting ready to go to market. Stress management, that's always a good idea, but it's not always possible in a feedlot situation. The chronic cough form of tracheal edema syndrome, there's really no effective treatment. The animals have just come into the feedlot and they start coughing and they don't stop coughing, so you might probably want to cut your losses, maybe take them to market earlier than you normally would, and just try to not lose too much money on those cattle.